I'm Health Unicorn Mike. Yeah, the guy with the unicorn on his head. I'm a nationally licensed, award winning health insurance broker. I offer affordable health coverage that creates tax deductions for small businesses. I've helped thousands of entrepreneurs and their families. I'm actually licensed in 33 different states. Been in the industry for 9 years, and I have access to 95% of plans that are available. Happy to help.
You work hard to get people health insurance. So why health? Why health insurance?
Health insurance is something I've been involved in for a while. It's probably been about 9 years. And the motivation there is it gives me a direct interface to help people. I used to be in the uh, in the large financial advisor with Penn Mutual before I got into the health insurance space. And what I realized was that um, I wasn't really a fan of speaking the life insurance comparatively than I was speaking health insurance. And health insurance is kind of a language that most people don't speak, most people don't know about. I've probably been appointed with maybe 25 different carriers. So dental, so vision, kind of am able to break things down on a different level as a result. So that's pretty much where that came from.
Yeah, I know that we spoke before prior to this, and I was telling you that there are so many reasons why people don't consider like health a priority to them. And one of the reasons is because of the copay. Like you go to the doctor or the physician, right? And you end up getting a bill that's higher than what you anticipated. So how would you suggest that they go about picking their plans, the process? Can you give us one?
Yeah, it just kind of depends on what you're looking for, right? So um, there has to be a point of delineation. So if you're under the age of 65, you want to use 65 as the point of delineation because over 65 is Medicare. So just dealing with Medicare, Medicare supplements, SSI, SSID. It's a whole different ball game, all different jargon. For the sake of this conversation, we'll keep it at the under 65 level. When you're at the under 65 level, there's really only three ways to get full coverage in the United States of America. In the whole country, there's only three ways. The first option is a age-rated option. Those plans are pretty much designed for those that have over 50 employees. That's another point of delineation there, over 50 employees. So if you're dealing with over 50, it's going to work entirely different than if you're dealing with under 50. Just like Medicare will work differently than the under 65. So that point of delineation is necessary. But when you were doing things under 65 and you are dealing with the coverages, you're going to be dealing with age rated. Age rated is going to be your employer plans. That's when you're dealing with like your HSAs, your high deductible plans, your IRAs may be attached to it. You may have attached it to your 503c. 503c, which is like your nonprofit structure or something like that. Maybe your everybody that works there is W-2, right? Especially maybe a huge company like an AT&T or the military or something like that. The rules are going to be entirely different in that dynamic there, right? So if you're shopping for insurance and you're trying to really give a breakdown of it, um, going with the over 50 employees structure may not necessarily work the best for you, just depending on what you have going on. If you have under 50 employees, though, or if everybody is 1099, then you want to instead do things on an individual basis. So when you do things individually, there's really only two ways to get full coverage in the United States of America. The first option is a public option. The second option is a private option. Now, the public option is going to be an income based option. It's actually designed for those that make under $34,000 a year or those that have chronic health conditions. So if you're not fitting into either of those categories and you go that route, you're actually going to pay a lot more money out of your pocket, as much as a 400% increase. That's what Obamacare is. So if you're low income or if you have chronic health condition like diabetes, cancer, heart attack, stroke, something, constant where you're dealing with medications all the time, then you want to go with that Obamacare type of option. Um, if you're not in those categories, though, then the alternative that you may want to look into is actually going to be a private option because a private option is health based. So, again, you do age rated, that's the employer coverage, or over 50 employees. Income rated is the public options. And then you have the private options, which are health based. So, it kind of depends on what you're trying to do. what you're trying to accomplish as to the best ways to shop for it. But if you're talking to someone like myself, I would narrow down each of those options to figure out, hey, did we need to go this route, or this route? Because if you can narrow it down, it makes it a lot easier to actually help somebody.
So what happens if you don't make any type of income at all? Do you qualify for any kind of health insurance?
Potentially. That's what is Medicaid. So Medicaid is a government-run program. Um, so you have Medicaid and Medicare. Medicare is over 65. So when you care for old people, and you have Medicaid, you aid the insolvent, right? You aid the broke and the shut in. So Medicaid is going to be a state-run government program that's going to allow you to potentially get insurance without any income, or you can still also potentially apply for Obamacare. So from Medicaid to Obamacare, there's a delineation there of from 17,000 to 34,000. So if you're in that threshold where you make over 17,000 a year but under 34,000 a year, then you qualify for Obamacare, but you qualify for Obamacare with a subsidy, which means that the government's actually going to pay for part of the cost of the insurance. Versus if you go with just pure Medicaid, that means that you're under that $17,000 threshold, in which case you're able to actually get yourself insurance that doesn't cost you anything because the government is therefore funding it. The issues, though, is that a lot of doctors may not take the coverage. You have to keep your income very low, or otherwise you can lose the coverage. Even if you get a subsidy, you may even have to pay that money back at the end of the year if your income changed. So going based upon income, or going based upon the level of poverty that you're at, gives you options, but doesn't give you the most robust options, if that makes sense.
So what happens when for example, like for our community, not everybody likes to go to the doctor. People don't even know what health insurance is, or they don't even want to bother themselves to go into health insurance. What would your advice be? Where will you begin if I know nothing about health insurance? I don't know that I am actually capable of going to the doctor. Where do you begin to advise someone to, there are options for them out there?
Okay, like for them to get insurance or for them to sell
No, for them
insurance.
to get it first, you have to be able. So I know
Okay,
nothing
okay,
about insurance, right? Nothing. I know nothing about what my options are for me to be able to fall sick and actually go to the doctor, right? So, in our community, most people fall sick, but they just remain at home because they don't know that they can actually go to the doctor and seek help. Where would we begin?
okay. So you're in essence talking about qualifications, right? So um, to determine which route made the most sense, whether employer coverage or individual coverage or private option, I would ask them a couple questions. I would want to know, hey, do you have any medications, pending treatments, diagnostic testing, surgeries that need to be covered? Anything over the past 5 years I need to know about. Any pins, plates, screws, shunts, pacemakers, any diabetes, any felonies. If they can say no to those questions, then that's going to kind of determine where they're going to go. The second point of delineation there is going to be on the income perspective that you were mentioning, which allows us to talk about things monetarily. So if they're, hey, my income's really low, all right, we have your Medicaid, you have your public option again with the subsidy, all right, and then the other part of that in regards to kind of, hey, I know nothing about insurance, where do I go? Well, one, you're probably gonna have had insurance from your job, or on your own before, so you at least have an idea about it. What I would tell you, especially, is ways to use your insurance in ways that would save you money, because most of us don't go to the doctor because we're worried about those copays, those deductibles, those bills that you just spoke of, right? So I would say, hey, make sure you're going to the urgent cares, make sure you're going to the standalone facilities, make sure you're going to places such as Quest Diagnostics to get your lab work done, or Tower Imaging to get like your imaging center done. People oftentimes think incorrectly that you're supposed to actually get things done at the hospital. The hospital is actually only designed for emergency situations. So that way, when you do go to the hospital, that's why you pay so much money out of your pocket, because they're setting you up with an emergency fund or emergency billing there, as opposed to just your regular checkups, physicals, or whatever it is that you're needing.
Yeah, I mean, this is why, because of the complications and all the paperwork that people have to do, this is why people stay away from, health insurance. Um, Man, so we have HSA, we have HPO, and something else. Which one is the best options for people that know nothing about health insurance? Just the best option for me to just be able to start something.
Um, it depends on what you qualify for, but ideally, if you can get yourself a health-based PPO, that's going to be the best way to go.
Okay.
And HRA is just a health reimbursement account. What that means is that you're able to get some money back at the end of here because of the setup of you have. It's typically under a tax code 15B, HRA 105 is the reference point for the tax code there. But typically under a group option, you're more likely going to have an HSA than an HRA. You're going to have tied that with a high deductible type of plan. That's the only way that the HSA is accessible. That's a health savings account wherein your company or your employer puts in some of the money, and then you put in some as well. And typically try to match you, not 401k, but more so for a strategy there to put like $3,000, right? And what you do is you use that for your medical expenses so that you're not having to deductible. So if your deductible's $10,000, save money towards that deductible. You instead use your HSA funding, which will allow you to actually get things done, like get your medications, get your urgent care visits, get your dental visits, whatever it is that you need. It's almost like a credit card that you use that your company is sponsoring. That's only, again, under the over 50 employees segment of things.
Mm-hmm. All right. So I know that all you do is health insurance, and I really do trust your ability to be able to help people, to get the best health coverage that they need. How would people be able to reach you, and what is it that you actually do, and how do you offer it to people? Because I want people to be able to know that they can reach out to you to get their health insurance.
They can always look me on my website, www.healthunicornmike.com. They can also hit me up on Clubhouse if they're on Clubhouse, on Facebook. I'm all over the place. Pretty easy to access me there. But the best information is on my website because it teaches you about health, private health insurance, public, the options there, has some videos up there, really rich with SEO content. Something my wife actually came up with a fantastic website there. So I'd be the best point of contact there. And then how do I go about doing what I do? Well, um, I compare options, right? So we narrow things down. I ask a few questions to figure out which route to go. You would go through a public option, right, where you're able to see all the government plans that are available. Look at the private options that are available. And once we figure out which situation makes the most sense based upon the criterion and the qualifications you have, it's going to determine which route to go. The applications themselves, depending on which one we go with, takes about 15 minutes. And I'm able to typically start coverage as soon as the next day, depending on what you have going on, or following month. But it all comes down to qualification because different insurers work different in different areas for different people, based upon their needs. So you want to make sure you're signing something that actually makes the most sense for them.
Thank you for joining me on this podcast. And I look forward to being in your rooms and, just listening to what you do because you really do help people and you provide value for people. And I don't want to take that away. So thank you, Mike, for joining me. And I look forward to seeing you in your rooms.
Awesome. I look forward to seeing you as well.